Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit systems of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Jenny Sutherland, and with me today is one of my favorite guests, June Green. Thanks for coming on, June.
Thank you for having me.
Well, it's a pleasure. You have been with us before, and we've talked about your work and your co-workers' work at hospice care in the Berkshires, and we thank you all for that admirable work. We've also talked about the 5 wishes form and how important it is for people to fill that out so their loved ones know about end-of-life care and their wishes, so thank you for doing that. And today, you're back again to talk about something equally, if not more important than those things, and it's a topic that is a little tough to talk about. And so you're going to share with us some information about the Pediatric Palliative Care Program that is also out of hospice care in the Berkshires. And some people might be thinking, I don't want to hear this, I want to change the channel. And I know the studio here got a little quiet when we said we were going to do this topic, but it's important to talk about and hear the information about why.
It's important because it's one of those programs that if you need it, you really need it, and it's good to have that information ahead of time. Hopefully, you might want to have that mindset of, I'm hoping I'm never going to need a program like this, but when you do need it, it's wonderful to know that that resource is available to you in Berkshire County.
Yeah, and if you hear about it today and you have a friend or a family and you can refer them to you, that's always good to be a source of information. So it's important. The services that are offered, who qualifies for them?
The Pediatric Palliative Care Program is, first of all, it's important to note, it's a totally separate program from our hospice services at Hospice Care in the Berkshires. This is a totally separate program, so while it offers some services that are similar to hospice, it's totally separate, and it's a program for kids under the age of 19. So we can have kids in the program from birth all the way up through 19. And the kids in that program, the criteria for the program is very easy, easier than I think any program I've ever worked for. Basically, the children in the program have to be a resident of the state of Massachusetts. They have to be under the age of 19 and have a life-limiting illness, different from a prognosis of 6 months or less. That's what's required for hospice. In the PPC program, the children have a life-limiting illness. So they're expected to, if the disease runs its normal course, to not live a normal lifespan.
Okay, and it does sound like the criteria can fit a wide range of ages and periods of being on the program. So. Yeah,
true. We have kids in the program right now as young as, I think our youngest right now is 14 months old. Our oldest is 17, almost 18. And some of the kids have been on the program for 5-6 years now. Some of the kids have been on the program a much shorter length of time. So it's a wide variety of kids, wide variety of diagnoses. So we have kids in the program that have heart conditions. We have kids who have mitochondrial disorder. We have kids who have aortic stenosis, a wide variety of diagnoses. And really the criteria is just that a doctor says that their illness is something that potentially will be life-limiting for them. Okay.
And how much does this cost to be on the program?
That's my favorite question to get
asked. And
asked.
that's why I asked it just like that.
Because it does not cost anything. The Pediatric Palliative Care Program is funded through the state of Massachusetts, and it is a free program to any family in the state of Massachusetts. We serve all of Berkshire County, and all of the services that we're going to talk to you about today are free of charge, which is a wonderful thing because a lot of the things we talk about are not cheap services and are difficult to access in Berkshire County. So it's a wonderful resource for these families and these children.
And I love that the state does that. I love that it's free. And I know part of what you do for this program is be mindful of the budget and watch the state and stuff, so you're always keeping an eye on how things are funded, aren't you?
We're looking at that all the time. Right now we have 17 children in the program. The reality is, though, that if we look at the statistics, there are at least 40 children that we know of through the state database that have what's called block nursing in Berkshire County right now. And so there's a lot of kids that would be eligible for the program that aren't in the program right now. And we're always looking at the state budget to look at what's going to happen, because we haven't found out yet what's going to happen for our next fiscal year. And we're always looking at that to see what the funding is going to look like so that we can plan ahead for what services we can offer and how many kids we can have in the program.
And we're going to go back to that in just a minute, because I want you to share what the services include. That's important to know.
So similar to hospice, every family gets a team of people that are available to them, but they can kind of pick and choose from a menu of services. But primarily they get a nurse, they get a social worker, they get a chaplain. And then they also can get complementary therapies that we'll talk about as well, I hope. So they get those services available to them, where the nurse comes in, and I know our nurse Jen Charbonneau is going to talk to you more about it, but the nurse comes in and does hands-off nursing. So it's different from hospice in that she doesn't come in and do hands-on nursing care. She's not able to come in and prescribe, talk to the doctor and order medications as much. So there's a difference in that, but Jen can talk more about it. Okay. But we have so we have social workers, nurses, chaplains, complementary therapies, and our volunteers.
Yeah, and I just want to take a second and thank the folks who volunteer for the Pediatric Palliative Care, the PPC Network program, because those are phenomenal people. So all those services, and they're tailored to the child and their families, because the services are also offered to families for support?
Yes, it's a little different from hospice in that in hospice we do treat the family as a unit of care, but some of the services we offer are only specifically for the patient, as compared to in the Pediatric Palliative Care program, we can offer a variety of services to anybody in the family, including the siblings of the child who's our primary patient.
And that was one of my favorite parts of the program to hear about when we talked about it, because you really need to support everyone involved in this to help them get through it. And you said the complementary therapies, and can you share with us, I think they're integrated therapies?
Yeah, they're called complementary therapies, or some people call them integrative therapies, and those therapies include we have music therapy, we have massage therapy, and art therapy for the children and for their families. So that's a wonderful component to the program, to be able to have someone who comes to your home to do a massage, or to provide art therapy, or any of those things, to come to the home, because a lot of these families, they spend a lot of time going back and forth to Bay State Medical Center, to Boston Children's Hospital, and it's really nice for them to have some services that come to them. So all of our services will go to the home, anywhere in Berkshire County. So we have those complementary therapists who come in and provide that. The extra TLC kind of things, a different kind of opportunity for the kids to interact with somebody. Some of these kids don't get to go out a lot, and they're pretty much housebound. So it's really nice to have someone who comes in and offers these services to them.
I think that's great. And you shared with me a story about a young boy and music therapy. Can you talk about that?
Yeah, I enjoyed talking about this little boy. We had a little boy in the program. He, when he came to us, he had just coming off of chemotherapy and had a lot of issues related to his ability to, he was very developmentally delayed. So, so some things he might have been doing at that age he wasn't able to do yet. And what's been wonderful was the ability to have music therapy come in, because it's one thing to try to encourage a child to develop those gross motor skills and to do all of that, but it's really different when you have a music therapist who comes in, and our music therapist who came in with that family was able to come in and play a lot of different instruments and quickly learn the instruments that this child liked. And what we've seen over time is this child was really not able, he wanted to grab things but really couldn't do that, and now he's able to reach out and grab some of the instruments and pat on the drum and do some things, because he wants to make music too, and it's encouraging for him. So that's been a wonderful program for them. And actually, I didn't tell you this story, I just recently saw a progress note from our music therapist where she said that one of the parents had said, we kind of would like it if you would just move in, because he is more calm and stimulated, and it makes such a difference in his demeanor when you're here. So it was really nice to hear that it's having a big impact for that family.
Yeah, and thank you for I have thought about that story since we talked about it a little while ago. Another thing that I think is actually amazing with supporting the whole family is respite. So that's important that people get the time
Yeah, I'm glad you brought that up because I forgot to say that before. Respite is a very important part of the program that we offer. So we're able to pay for the family to get up to 40 hours of respite per year. So, and it's not respite, like in hospice services, we talk about respite in terms of putting a patient in a nursing home. This is a respite where we can pay to have someone come in to take care of the child so that the family can do some other things. So, for example, a family might have someone come in to take care of the child so that the mom and dad can go to the little sister's music recital at school, or so that mom can go out and do something as simple as go grocery shopping or get her hair cut. We also, the families have the ability that they can use that time in little bits of time, so they can use an hour a week for 40 weeks, or they can use all of it in a lump. So a couple may be able to, if a family wanted to, have like a couples weekend, let the mom and dad get a little bit of break from the caregiving and recharge their relationship and have that time together. So they might have respite come in, and we can pay for whatever that child needs for that respite. So sometimes it's a neighbor who's going to come in and do the respite. Sometimes the child has more intensive medical needs, so they may need a nurse.
Okay.
So sometimes we're going to have a nurse come in. We recently had a family where they're block nursing, and block nursing is basically where you have a nurse who comes in to the home to take care of the child. And their block nurse was not going to be able to come for a period of time. That was going to be a huge issue for this family because that nurse is there overnight. So we were able to pay for respite for that so that they could have a nurse there and be assured that they could sleep and the child was going to be cared for.
That's fantastic. That's fantastic. I said we were going to come back to something, and that was the funding. Because I want to segue into something important to both of us, and you made very important to me after talking about this for the first time. Funding, again, is from the state, and all these services are free to the families and the child, which is phenomenal. But there's only so much in the budget every year, and now you're waiting to hear about next year. And people donate. You get philanthropical donations. So that's fantastic, and we want to encourage people to think about that. So what happens if there's too many referrals and too many kids wanting these services?
Well, basically, the hard part of my job is looking at how much we have in the budget and whether we can take another child on to the program or not. At this point, we've been very fortunate in that we have never turned away a family that was eligible. We haven't had to turn them away. But we're really at that point where we're kind of over the point of that cusp where basically we're looking at that we might have to have a wait list.
Okay.
So a child might get referred to program, and it's important to note that some of our kids get referred when they're close to death. There's not a lot of time left for them to be able to benefit from some of these services, and those families really need that support. So right now we have 17 kids in the program.
Yep.
I do have one child that we're working on admitting, but we are at that point of saying we might have to wait list.
Okay.
And across the state right now, there's somewhere around 80 to 90 children that are waitlisted at the other programs that offer the pediatric palliative care program. So we're hoping not to be one of those programs, and not have to waitlist anybody, because it's just so important for them to get these services.
And you and I both decided that we want to work together so there is no wait list in Berkshire County for these. So I look forward to working on that with you. We're going to take a quick break, June, and think about how we don't want children to be on a wait list for this phenomenal program. And when we come back, we're going to be joined by two more folks to talk about pediatric palliative care. Thank you.
Thank you.
Nestled in the center of the picturesque Berkshires of western Massachusetts, hospice care in the Berkshires has served the county for more than 30 years. Hospice Care in the Berkshires is a proud affiliate of Berkshire Healthcare, the state's largest nonprofit provider of nursing, rehabilitation, and senior housing in Massachusetts. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Hospice Care in the Berkshires offers comfort, compassion, and the emotional and spiritual support families and patients value when faced with life-limiting illness.
When my mother-in-law was diagnosed with terminal cancer, we had hospice come directly to our home. It's where she resided and wanted to have her care done. It was a tough time for the family because it was a shock to find out limited amount of time that she had. But when we started working with hospice, they came in and worked with us wonderfully. They helped us navigate through all the administrative tasks. They told us about all the services that were available to both the patient and the family, the social workers, the home aides, the nurses, and really helped us get through this tough time.
Our caring, dedicated, and experienced team of professionals supports patients and families where they live, whether it's at home, a nursing home, or assisted and independent living facilities. This team includes hospice-trained physicians, hospice nurses, family counselors, spiritual counselors, and hospice aides.
Oftentimes people ask us, why do you work for hospice? Why would you do this? Why do you work with dying patients? And I think most of the people on our team would say that it's an honor to work with people at end of life. It's an honor to try to support families and patients through end of life, to make sure that they are cared for with dignity, that they die peacefully, that their families are supported through that process. It's our goal to make it even a little bit better if we can. We can't change the outcome, but to be there and to support families through the process and patients through the process in every aspect is really important.
And we do try to support both the physician and the patient and family at this time in their lives in whatever location that patient and family want to be.
And I just knew that when I retired, I wanted to be part of helping people that were dying and didn't have someone to be there to support them. I knew that that's something I wanted to do.
Our incredible team of hospice-trained volunteers are instrumental to the support we offer families. Our team of over 100 volunteers helps with transportation to appointments, running errands, and respite for the caregivers.
When you know that you can make a difference and that person is secure and feels not as scared because they have someone to sit there to hold their hand, I just can't tell you, you just feel like you're floating on a cloud when you leave. And to be there when they actually die and to know that you've made it easier for them, you just can't explain that.
Hospice Care in the Berkshires is grateful to the many people who make donations. All the funds raised support the agency's community programs and services, an integral part of how we serve Berkshire County.
Bereavement services at Hospice Care in the Berkshires are funded through philanthropic dollars from the community, and that would include donations, memorial donations, and also community events that we have, such as our gala, our remembrance walk that we have every September, and that allows us to provide bereavement services to all members of the community, not just folks who were hospice patients' families.
I would definitely recommend hospice care in the Berkshires to other families. Again, the range of services was wonderful. In fact, I love the organization so much that I now volunteer and help other families who are going through it.
Choosing hospice isn't about giving up on life. It's about choosing the support needed in order to live a full life right now. For more information about how hospice care in the Berkshires can help, call us at 413-443-2994.
Welcome back to InfoSource, and with us today is June Green, and you're joined with some other folks from Hospice Care in the Berkshires that work with the Pediatric Palliative Care Program, Jennifer and Sienna. I said it wrong, didn't I?
You said it right,
I
Sienna.
did. Okay. All right. I like to get it wrong and then get it right, but I did it right. Jennifer, you are a nurse, and you've worked both hospice care and pediatric palliative care. And can you tell us a little bit of the differences that are between the two programs?
Yep, so I'm sure June already touched upon the kind of kids that we have, that the big difference is, one is the kids are not terminal when they're on the pediatric palliative care program. In hospice they are. The major difference is the nursing for the pediatric palliative care program is more consultative. It's not quote unquote skilled nursing. So we're not going in and doing things with their tubes or oxygen. We're going in and trying to help the families with some symptom management, but suggesting things instead of being so hands-on. It's also visit frequency is very different. Hospice kids we see weekly, or whereas the pediatric palliative care depends on sort of what the family needs. And it's also a balance between social work and nursing more also.
Sure.
So.
And we kind of mentioned this. A lot of the families have to travel out of Berkshire County, so you're dealing with doctors in Boston. And sometimes you're dealing with doctors out of state
Out of
even.
state, yeah.
And so that must become something that you're involved in a little bit with?
Yeah, it's definitely a coordination. Unfortunately, for us in the Berkshires, we don't have a strong pediatric specialty, so a lot of these kids with their complex care needs are being seen in either Bay State or Boston. And unfortunately, that means something simple like a GI bug or a common cold can mean these kids are going to Bay State because that's where their specialists are. And a common cold is not a common cold for a kid with major respiratory issues.
So what you're saying is that if a child that is in the program gets sick and it makes it more complicated, instead of just going down to the local hospital or to their local doctor, they might have to travel all the way to Springfield or Boston because they have the stomach virus.
And not only traveling, but that also means sometimes these kids and their parents aren't home sometimes for 2-3 weeks at a time because they are inpatient at some of these hospitals. So it affects the siblings, it affects families, school. Yeah, so it's definitely a different sort of nursing.
And you said that social work and nursing work very close together, and thank you for coming on too. Can you share about some of the things you do to support these families? Because it just sounds like an enormous lot of pressure and strain at a time when it's emotional too, and just it must be overwhelming.
It's true that there is a lot of pressure. There's financial pressure, there's emotional pressure, there's pressures on the families, the marriages and the siblings, as Jen said. There's, of course, so part of social work is to help with stress management and to help with some of the simple things that become complicated. The nurse and I work well together about questions of sometimes, for example, parents may not want to discipline a child who has a major medical issue, but all children need to be told no sometimes. And so sometimes there's some very basic parenting questions that come up and support that makes everybody happier when the child isn't running the show. And you can understand why they would want to say yes all of the time to a very sick child, but even a very sick child can't stay up all night eating ice cream, and there still has to be a limit to those kind of things. Social work also helps to connect them to some resources, sometimes helping with things like applications to the Department for Developmental Services or to heating assistance or those types of programs, and even just having a place for emotional support and a place to talk through the concerns, because what can happen is that there can be a crisis that they need to kind of process through, but the focus should be, once the crisis is over, on enjoying their day-to-day life. And so having a little place to process and get their questions answered, get some support so that they can get back to enjoying their family.
Sure. And you also, I love the respite part of the program. I love that there's volunteers that help out. I love the music therapy and the art therapy and just this whole support system. But it's true that statistically, families can sometimes fall apart during this, so that must be hard.
It's a lot of stress on the family, and so having a chance to make sure everyone gets their questions answered. For example, if one parent is taking the lead on the medical side of things, the other parent might be judging what's happening as a failure of the caregiving parent rather than seeing how hard it is to do that care. And just being able to bring those things and normalize them can be a big help. And to bring forward the stresses on the family can do a lot to help normalize and calm down the family system.
So again, we hope people don't need this services, but we want people to know about it so they can refer and talk about it. And it's just incredible that this is going on, and it's available in Berkshire County and in, 8 other across the state?
There's 9 programs across the state right now. All of us in the same boat right now, waiting to see what our budget's going to look like.
Oh, and you brought back the budget again.
Yeah, I got to keep bringing that back.
I'm going to bring up 2 things. One is the budget again. And then we want to say if someone would like to make a donation, how can they donate to the pediatric palliative care?
They can contact Hospice Care in the Berkshires. We're at 877 South Street in Pittsfield, and the phone number is 443-2994. And we'd love to talk to people about donating to the program, volunteering for the program. We always need volunteers. But there's definitely a need for more philanthropic dollars right now, because I don't want to have that wait list.
Yeah, I think we're really committed to no wait list. Very no wait list. Okay, I'm trying to think if there's anything else.
Can I say one last thing about the program?
Yes, you can.
I want to say how much we focus on quality of life. We were really excited. One of our kids yesterday had a 4-H group that came in and brought in a petting zoo.
Really?
This was for a little girl who's on a ventilator and cannot get out of the house at all. And we really help and encourage the families to do things like that. So they focus on those quality of life things. It's not all about being sick, and it shouldn't all be about being sick. That family has to still be a family and enjoy family activities. And if you can't go out to the petting zoo might come to you.
That's awesome. I love it. And you know, all the things we talked about are focusing on life and the quality of life. So thank you to all 3 of you. Thanks to your coworkers and the volunteers. You'll come back again. I think we'll have you back in September and see how
That'd
it's
be great.
going. We can talk about where the budget's at, maybe have some other things up our sleeves. And thank you again. We'll do this, get more information out to folks, okay?
That sounds great.
All right. And thanks to you for watching. InfoSource is a presentation of Berkshire Healthcare Systems. Thanks.